Coming up next is Dr. Kimberly Taylor. Here's your chance to talk about what matters to you. Although you will receive helpful advice from Dr. Taylor, remember, this is not to be construed as a form of psychotherapy, diagnosis, or treatment, and cannot replace a therapeutic relationship with a mental health professional. You can reach Dr. Taylor by calling 564-1290 or toll free at 866-564-1290. You can also listen live on the internet at drkimtaylorshow.com. So here now is Dr. Kimberly Taylor.
Welcome to the program. I am Dr. Kim Taylor, your Thursday afternoon psychologist, and I'm bringing you this hour of the week where we actually get to focus on you and the issues that are important to you. Those of you who have heard the program know that this is the place that we can talk about whatever's on your mind. Questions about your life, your relationships, your mental and emotional health, and everything else in between. Here's the place you can ask those questions. The truth is that through your sharing, that not only can you get the help that you need to make changes in your life, but others who are listening can benefit by hearing your story, as it may be the same as theirs or at least similar, and something that they might need to hear to help them deal with their own issues. If you need some help with your significant other, if you're having teenage problems, work issues, parenting questions, or even if you want to double-check thought that you have or a choice that you are in the process of trying to make, this is where we can figure it out and help to make sense of your life. I've been dealing with these and many other issues in my practice with clients for almost 20 years, and I'm hardly ever surprised. Now, with the fact that I am going to be taking phone calls, I also want to let you know that I will also bring in some other experts in specific fields to explore some topics in a bit more depth. There are many people out there in the city who are in the helping profession and who are specialists in their field, and they have information and quite a bit of advice and services that are out there to help you. So to start off, next week on my show, my guest will be Dr. Winifred Lender, and we will tackle the issues of sleep disorders. And I know for a lot of you out there that this is a very important topic because there are many kinds of problems with sleep. So if that sounds like you, or if it sounds like you may know someone who has this problem, this will be the program that you won't want to miss. We will be here to answer your questions and to take your calls next Thursday between 2 and 3 p.m. And then today, in the second half of our program, we are going to be joined by Dr. Lisa Firestone. She is a clinical psychologist. She has recently co-authored Sex and Love in Intimate Relationships. She is going to be having a weekend retreat workshop here in Ojai. The dates for that are November 8th through the 10th. And she will be here with us today at the bottom of the hour to talk to us about how to have a successful relationship and to answer some of your questions. So stay tuned at 2:30 and she will join us. I would also like to hear from you about any topic that would be of interest to you. This program is for you. So if you have questions or if you would like to send in your thoughts and ideas, you can do so by sending them to me at drkim@drkimtaylorshow.com. I feel that there are many paths to learning, and there is much information out there that can help. So I want this program to be a source of information that is both educational and inspirational. My job here is to help you understand yourself. If you're able to understand a bit better what you feel and why you feel it, then you will be more able to create the lives and relationships that you want. You have to be willing to risk telling the truth and be more open so that you can grow and allow others to know you for who you truly are. So get on the phone today. I want to talk to you. You can once more reach me by email with your questions at drkim@drkimtaylorshow.com. And my screener, Sandy Jacoy, is waiting to take your calls here. She'll be the first one to talk to help get you ready to come on air with me. So get on the phone and give me a call at 805-564-1290 or toll free at 866-564-1290. I will be right back after the break to take your calls. I'm Kimberly Taylor, and you're listening to KZSB AM 1290.
You are listening to Dr. Kimberly Taylor. You can reach her by calling 564-1290 or toll free at 866-564-1290.
Okay, we're going to go on the phone now, but I want to first like to do is to remind you that Dr. Lisa Firestone will join us here at the bottom of the hour talking about love, relationships, and how to make them work. So right now we're on the phone with Fred. Hi, Fred. How can I help you?
Dr. Kim, how are you?
I'm good. What's on your mind today?
Well, I've been married for about 30 years. I'm 60 years old, and my wife and I have had a family. The kids have grown and gone. After the birth of our second child, my wife started having a lot of problems with obsessive-compulsive behavior, I think because of the complexity, and was subsequently diagnosed as such and has been medicated for quite a while on some of the drugs that are associated with controlling that. And I think over the years, you get a bit of a thick skin when you live with somebody with OCD because of the unpredictable outbursts. And I think we've done everything we can for her at this point to try and help her with the situation. I guess, what advice can you offer to somebody in this situation as to what, I should be doing to try and make the situation better? It's very easy to become defensive. But from your experience, what do you feel I should be doing to help her or help the situation?
Mm-hmm. What do you do when you become defensive?
Well, there's avoidance. That'd be the first thing.
Okay.
And I think depending on whether you see it as part of the behavior, if you're open-minded enough or aware enough to treat it as part of the behavior and you analyze it that way and you're analytical at the time, it's great. But I think it's very easy to react, which just inflames the situation. So it becomes something you perceive as just a criticism,
Mm-hmm.
Unwarranted criticism, boiling into real confrontation and bitterness.
Okay, so what you're saying is that you're finding it hard to not feel bitter and not feel angry and therefore to withdraw when this happens.
Correct.
Okay. You said that she did receive a medication. Did she ever go to therapy to learn strategies about how to manage the thoughts and all of the behaviors?
Yes, and I think that went on for probably 6 months, along with trying or a year, as we sorted out a couple of different drugs that were available to her, and that was part of the whole thing.
Okay.
Go ahead.
Well, but you're saying that she only spent about 6 months on that, and this started at least 20 years ago?
Yeah, at least 20 years ago now.
Okay. Do you feel like she has worked really hard by learning strategies about what to do when these thoughts come in?
No, I think it becomes completely organic in response to it. I don't think there's any thought process. When something irritates her, it really irritates her.
And then she plays this out on you because she is not learning how to manage those symptoms.
Correct.
Okay. Have you ever sat with her and told her that what she goes through is interfering with the love that you feel for her, and that when she starts to do this, you feel like you want to withdraw, and that you need her to go and find more skills and tools to use to be able to manage it when it comes up?
Yeah, I haven't approached it that constructively, but perhaps I should.
Okay.
I'm asking.
Because there are two parts to the treatment for her. One is to have meds, but the other part is to really go in and spend some time learning what kind of things that she can do instead of what she is kind of driven to do. And so it is a two-step process. And if you feel like she is not doing enough or taking enough responsibility for her problem and making it come to interfere in what is going on between the two of you, then you need to tell her that.
Okay. Is this also something that should be done as couples therapy, or is there
Well,
what's the standard procedure or what is the accepted procedure for this?
Well, what you're saying is that right now her problems are getting in the way of the couple issues. There actually could be a lot of things going on between the two of you that you could deal with within a couple's therapy. But I think that she first needs to be able to learn some tools and skills on her own about this problem, because you can't change this problem for her. She has to be willing to go and do some pretty hard work to work with someone and then to practice using the tools.
All right. So is there a recommendation on who or how or the nature of who this group is or whatever?
I'm not sure where you live, but what I would look for is somebody who deals with anxiety issues, because this is under the umbrella of that, and who works in a cognitive behavioral way, which means that they're going to really be able to provide strategies and tools, that it isn't so much going back and exploring the past or the childhood as much as it is to provide actual tools.
Okay.
So that probably would be your best start.
All right.
But what it does sound like is that for you do need to let her know that this is interfering with your ability, that she may have come into the marriage with this. It could be part of her baggage. And we all have baggage coming into our...
It seems to be very prevalent in her family.
Okay. But and so it is not to put her down about what is going on, but to insist that she bring it out in the light of day so that she can work on that, so that she can work so that it doesn't interfere with what's going on between the two of you.
Okay.
Okay?
Terrific.
All right,
Yeah.
good.
Okay, thank you very much. Appreciate the advice.
Okay, and thanks for calling.
Okay.
I'm Kimberly Taylor, and you're listening to KZSB AM 1290. Hi, we're on the phone now with Anne. Hi, Anne.
Hello, Dr. Kim. I wanted to tell you about an experience that I had with a call that you had last week. I don't remember the woman's name, but she called in about recovering from cancer and doing pretty well, except in the night she was very frightened and couldn't sleep. And you talked to her for a little while, and then you said to her, with a pause in your voice, "What would you say if I told you the fear would never go away?" And I, too, have this fear and sort of anxiety problem now and then, and I suddenly realized, and I mean suddenly, from just that one sentence, that I've been spending all this time trying to make the fear go away. I have not focused at all on what I could do about it, about the fear, or how I could handle the fear a little bit better, but always, always get rid of the fear. And it never worked. I'm still exactly in the same place I was years ago. So I would like to talk to you just a little bit about what sort of dialogue I can use with the fear when it arrives, when it pounces on me, to help myself deal with it in a better way, to be more constructive about it, and to live my life with it.
Okay. Well, I think it's a good question, because I think for most that when we have our fear, we want to just stop. We want to run. We want to get rid of it. And so we spend a lot of our time just on that.
Yes, exactly.
Okay, so the first thing that I would tell you is you have to acknowledge that you are feeling fearful. And that may sound odd, but to actually say, oh my God, this is how my fear feels. And to feel it within your body. Does it come within your stomach? Do you feel it in your neck? I mean, where do you feel it? Sometimes it's just right in the middle of your gut. And that let yourself feel it and to understand that it's there for a reason. It's there to warn you, and to then be able to check out what am I afraid of? Is this real? Is it imagined? Because once you start to do that, you will then know whether it's something you have to act on or whether you just got triggered and you can let it go.
It sounds so reasonable. I can actually talk to the fear.
Mm-hmm. Yeah.
And I don't have to get rid of it. I can just, I don't know quite how to say it. I can just deal with it.
Well, the act of acknowledging it, rather than trying to hold it in, rather than trying to deny it or repress it or to do something else with it, when you acknowledge it, you feel it in the amount that you were supposed to feel it, in the appropriate time, which is the present. And then, as soon as you process it that way, it's done. It's over.
Is it actually gone for that moment?
For that moment. But some of the work that you may need to do is because you've been so conditioned to hold on to the fear and to not feel it and to deny it or numb it, that it is going to take practice, that this is going to be a moment-by-moment experience for a while until you practice handling your fear, identifying your fear, and being able to move through it.
Moving through it means discussing with the fear what's going on. It means actually having contact with the fear, doesn't it?
Well, let me ask you, if for instance, you heard a lion roar behind you and you had that fear response, what would you do next?
Get out of there.
Okay, but wouldn't you look over your shoulder to see if it was real or...
Probably not.
Okay. All right. Well,
not at that moment.
Well, but part of this is because you are so afraid of the fear that you're not willing to kind of check it out. You have to check it out in reality, because that same lion may be in back of you, but the truth is it may be in a cage and you're not in danger.
Yes, I see.
You have to check out whether it's dangerous and that you should run, or whether it is just the lion, but you're safe because he's behind the bars.
Yeah, I get it. Okay.
So use your fear in a way that it warns you, but it's your job to figure out whether it is a time that you have to run, or if it's a time that you can just say, oh, okay, of course I got scared because I heard it, but I'm actually safe.
Okay, and then Eleanor Roosevelt's remark that you just need to take your fear and go with it. It means that the fear is still there, but it's not so alive.
Well, what I meant when I had said that was that sometimes we are going to be taking risk, and so we don't know what is going to happen.
Yes.
But we have to be willing to move forward, knowing that we're not making a stupid choice. It's just a scary choice, but that we still want to challenge ourselves because we still want to grow. We still want to move forward. And so there are times that, yes, you just have to take your fear with you and keep going and not let it be your stopping stone, but the place that you step over and continue forward.
Okay, that makes a lot of sense. Thank you very much.
Okay, and thank you very much for your call.
Thank you. Bye-bye.
I'm Kimberly Taylor, and you're listening to KZSB AM 1290.
You are listening to Dr. Kimberly Taylor. You can reach her by calling 564-1290 or toll-free at 866-564-1290.
I'm Dr. Kim Taylor, and we are with Dr. Lisa Firestone. She's a clinical psychologist in LA and Santa Barbara. She's the Director of Research and Education at the Glendon Association here in Santa Barbara, excuse me, as well as the Senior Editor at psychalive.org. She has recently co-authored Sex and Love in Intimate Relationships. She has a few other books that she has also been a part of, which I would love for her to talk to you about. She has a workshop retreat that she's going to be doing in Ojai, California, November 8th through the 10th. So let's have her join us. Can you tell us a bit more about what you will be covering and what this workshop is about?
Sure. Thanks for having me on. I really appreciate it. The workshop is called Creating a Loving Relationship, and it's really a workshop for both individuals and for couples to come and work on developing our ability, or each of our ability, to both give love and to accept love. So it's going to be a workshop that really focuses on how to make a better relationship, hopefully giving people some skills and also some experience. We're going to be doing experiential exercises, and we're going to be doing some mindfulness practice as well, so that we can help to hopefully make this more ingrained or really sink in.
Mm-hmm. So what do you feel are the barriers that people have in trying to develop and to sustain a close, loving relationship?
Well, I think there's a number of barriers. I mean, one is that we often select partners who are not particularly ideal for us. If you ask people what they are looking for in a relationship partner, they give you a list of all kinds of great qualities. But on an unconscious level, I think that a lot of times that we're looking for somebody whose defenses kind of fit with our own. And so that maybe, we became sort of parental as a defense to cope in our childhoods, we may find somebody who's more childish, and then we kind of play out those dynamics. And it's not that people can't work on these dynamics, but if you have selected somebody like that and you're in a serious relationship with your partner, you can start to change those dynamics by really looking at them. So anyhow, there's the selection criteria. There's also ways that we tend to distort our partner and see them more in terms of people from our past even than how they really are. So we'll see them as being mean and critical if we had a critical parent, even though they may not have intended to say things in a way that was critical or mean. So we distort them in a way in our minds, often seeing a caricature of our partner, if you will, rather than who they really are. It's always interesting when doing therapy with somebody to then meet their partner, because often what you've gotten is kind of a caricature of the person, and they're not the same person that you would have imagined from how they were described. Also, that we tend to do things to provoke our partner to treat us in ways that fit more with our past, albeit more negatively. So we may do things that provoke them to be critical or provoke them to be rejecting or unavailable at times. And so it's really interesting to look at our half of the dynamic. So part of the workshop is going to focus on the fact that you can take 100% responsibility for your half of the dynamic, and that, while you can't change your partner, you can do a lot to change the dynamic by changing your half of it.
Okay, so what it sounds like is that they actually need to be willing to look at their part and to come to a workshop like this and ready to work not on their partner and changing them, but on really focusing on what are they doing that is either helping or what are they doing that is hurting. So that the focus is for each person is to really look at themselves. Is that probably
absolutely
okay?
And developing themselves, but also developing themselves in a way that's going to make them more available to their relationship and a better relationship partner. So it's kind of about each person learning how to be more loving.
Okay.
Both towards their partner, but also towards themselves.
So what is the first step? I mean, what do you need to do first to get them on the page, to be able to look at this and stop the pointing the finger and blaming their partner?
Well, one thing I suggest to people is to look at what your partner does that you like least, the thing that bothers you the most, that just drives you crazy. And then look at what do you do just before that helps invite that response. So I think about a couple I worked with where the woman, her biggest complaint was that he's always trying to, direct her and solve all her problems and fix everything about her. And when she looked at what would precipitate these kind of interactions between her and her husband, it was often that she would complain to him about a problem. And, she just wanted him to listen. She didn't want him to fix her. But in a way, she was inviting him in to do his problem-solving thing,
Which guys are very prone to want to do.
Absolutely. And, what was interesting, though, for her is to look at the fact that maybe she could do things differently and not present things to him in that way such that it invited that response. So I think there's a lot you can do to think about how you might have gotten a very different response from your partner. I mean, it's interesting because, feelings are something that kind of go through us just like a roller coaster. We don't get to choose how we're going to feel. But we do get to choose our behavior. And so the focus in this workshop is really on how can we identify what are our behaviors that get in the way of us having a loving relationship, whether it's by the people we're selecting or whether we're in a relationship with somebody and we're perhaps distorting them or provoking them. to be more that person than they really are.
Okay, so this makes me think about some of the work that I know that you've done as far as the critical inner voice that people hear in their own head that become rather destructive, whether they're thinking about themselves or even sometimes the way that they're thinking about their partner. Can you talk a bit more about that voice and how that works for people?
Yeah, I think that the critical inner voice is something that really interferes in our relationships. First, ways that we're attacking ourselves or being self-critical that might keep us even from venturing into a relationship, or when we're in relationship thinking very negatively about ourselves, which is obviously going to affect the quality of the relationship.
And the quality, I'm sure, of the response that they're going to have to someone else.
Absolutely. If we're thinking we're fat and ugly and not attractive to our partner, so we're not even caring about how we look, then we sort of end up provoking that response from our partner. But also we have critical thoughts about our partners, and that's part of the same self-protective function that the critical inner voice provides, which is we may think critically about them, picking them apart. We may distort them again and through the filter of the critical inner voice and see them more like our parents than they really are. And all those things really undermine our relationship. So identifying those critical inner voices, what we're hearing about ourselves, about our partner, about relationships in general, and we'll have exercises where we really look into that and then verbalize it, can really help a relationship. And actually by doing it in a way where we're taking back the projections, it actually kind of lets our partner off the hook. It also allows them to understand maybe some of our behaviors towards them that they haven't fully understood. And one thing we find is partners aren't very surprised about how their partner, the other person is critical of them, because they've either been hearing it directly or it's come across in their behavior.
What are some of the ways in which you help them to challenge this voice that comes up for them?
Right. So the first step is identifying it so that you can start to fight it. And it's hard to fight an enemy if you don't know what it looks like. So it's really important to kind of get a hold of what are the thoughts and getting them said out loud. And we have them say them out loud in a way that helps to separate from them, which is putting them in the second person. So instead of saying, I'm this or I'm that, or my partner's this or my partner's that, it's, you're this and you're that. He's that way, she's this way. Those help us to start to get some perspective on where these thoughts come from. And that helps us get some compassion for ourselves, and it also helps partners get compassion for each other. When they see that some of the worst behaviors of their partner really come from their past and they have some feeling for them about that, it really helps. So that's one thing that we start to do, is start to separate from them, start to see them more clearly, and then really plan actions to go against these negative thoughts, so not give in to the directives of our critical inner voice.
What I do know is that lots of times what I hear in practice is the love, the passion, and the sex dies out. And that what it does come back to often is the way that people are feeling about themselves, and then the way that they feel that their partner feel about them. So how do you help them with this, given this critical voice, and how to counter it, and how to really see that in part is one of the reasons, because of all the anger and the resentment that has been built up, that really kills any of the passion that was once there?
Right. Well, partly when you're seeing your partner through the filter of the critical inner voice and seeing them as kind of caricatures themselves, you don't feel so drawn to them. So that interferes with the love and the sexuality. And also, you're not acting in a way then, if you're acting on those voices, that would build closeness or intimacy. Also, if you're really critical of yourself, and you're thinking negative things about yourself and how your partner's not drawn to you or attracted to you, you're going to be less open to getting into an intimate situation with your partner. So by starting to bring these out into the open and challenge them, it allows people to get a bit closer. Also, if you have the idea that the love and passion has just gone away, we find that that's usually not true, that it's maybe because you've formed some kind of fantasy of connection with the other person, or what we call the fantasy bond, where you become kind of this merged identity. Person's become like your right arm, and you're not any more attracted to them than you are to your right arm. You don't think of them as a separate person, that separate person that you were originally drawn to, who had a lot of qualities you actually really liked or were attracted to is no longer the person you're seeing.
That, I think, is a really good point. But let's go back for a second. How does that, a fantasy bond, manifest?
Get created.
Yeah.
Well, I think that when we get into relationships, that initially we're drawn to the real person, and we're usually in a more independent kind of state of mind ourselves, and so is our partner. That's why they were attractive to us. And so we're really relating, but usually at some point we get afraid, particularly if this relationship or the way this person is treating you is different from how you were treated as a child, particularly in a more positive way. We often, at some point, get self-conscious or get afraid, and that could be when we decide to get married. It could be when we decide to have a child.
Mm-hmm.
And we start to see that person as, again, we start to form this fantasy kind of connection where we have very much in our mind the idea that we're still in love, but the actual operations of acting loving toward our partner drop out.
Mm-hmm.
And that's one of the things we really stress in the workshop is how to bring those actual actions that are loving back into your relationship as opposed to just having this thought that we're in love, meanwhile we're hating each other and treating each other pretty badly. Mm-hmm. What we'd actually like to see is loving behavior. Like an outside observer seeing the two of you relate could say, oh, that's a loving relationship.
Mm-hmm.
Because that's the way each of you are going to experience it. I also think it's really important to focus on showing your love for your partner in a way that they experience as loving.
Mm-hmm.
One of the things we often do in relationships is we show love in the way we would experience love.
And most don't have a clue about what really works for their partner because they haven't asked them, they haven't listened, and they haven't sat down to really see that they're two separate people, each with different needs.
Right, and with different minds that work very differently.
Right.
You know, one thing about a practice that we really stress of collaborative communication is to really understand that your partner has a sovereign mind, very different than yours.
Mm-hmm.
You know, we attribute a lot of our attributions about why they do what they do through the filter of how we would think about it and why we would do that,
right,
which may have nothing to do with why they would do it or why they might feel that way.
Yes, but we actually need to take one of those breaks. So we'll be right back with Dr. Lisa Firestone, and I'll see you right after the break. I'm Kimberly Taylor, and you're listening to KZSB AM 1290.
You are listening to Dr. Kimberly Taylor. You can reach her by calling 564-1290 or toll-free at 866-564-1290.
Okay, we're back. I'm Dr. Kim Taylor, and we are with Dr. Lisa Firestone. She is putting on a workshop retreat in Ojai, California called Creating a Loving Relationship. The dates of that are November 8th through the 10th. And during that workshop, what will they learn there, and what do you hope that each couple or person will get by going to this workshop?
Sure. I think that they will get some skills for communicating better in their relationship, some practice with experiencing what might be getting in the way of them creating a loving relationship, whether it's getting into that relationship or one that's been going on for a long time but has fallen into disrepair. I think they'll get some real skills and understanding about themselves, about their partner, and how to relate in a more loving way. And so it'll be a real experience. And they'll also get some practice with mindfulness and how that may help them to develop a different relationship to their emotions and their thoughts that will give them put them more in control and help them to be directing their life and their relationship in a more constructive way.
You brought up at the start that we actually choose a partner, and while we may pick the one that is the opposite or the same, you have some thoughts about how people choose their partners, right?
Mm-hmm. Yeah, I think that what draws us across a room to somebody is often because they have some characteristics that are reminiscent of people from our past, and I think on some level we're trying to kind of repair maybe some things that happened in our past. But often what happens is that we end up recreating our past instead of really repairing it. And what we want to help people do is repair it. Now, that doesn't mean we think they should toss that person out of their life. We think that, in fact,
You sure?
Yeah. In most cases. I mean, there's some cases where, yes, maybe you should.
Right.
But in most cases, it may be that if we don't learn anything from this relationship, we're going to recreate it in future relationships as well, and we're just going to, ask any divorce lawyer when they meet the new partner, they're like, oh my gosh, same person in a different body.
Right, so the pattern goes on.
Yeah, so you don't want to, and a relationship is a great place to work on relationship skills. So it's hard to practice them when you're not in a relationship. So I think there's a lot we can do, except for you can learn about yourself even when you're not in a relationship in ways that may help you do better in the next relationship. And that's what we want to help people have the skills to do, to understand themselves and also to be able to act really differently in their current relationship to make it better, but also in perhaps in new relationships as well.
Yes, because I think that we learn the most about ourselves by being in relationship with a partner.
Right, and relationships can push us to co-evolve, to both of us to develop, and that would be the ideal, and that's what course we would like to get people on, instead of where we're each kind of regressing and actually deteriorating to kind of this merged identity.
So what do you do, or how do you work with people who one is evolving and one is regressing?
Well, that's a real challenge, but that's one of the things that can happen if, for instance, if one partner's gone into therapy and maybe the other partner hasn't. So I think it can often be important for the partner who is changing to think about ways that they interact in the relationship that if they did differently might actually help their partner to develop. And this is where I think it's really important to be kind of strategic in how you deal with relationships, to really think about, wow, what is it I could do that would bring out the best in my partner? And what am I doing that's actually contributing to the dynamic and making it worse? So I do think one person, again, has 100% power to change their half of the dynamic. So that can spark your partner's interest in wanting to develop themselves and also really to shift the dynamic. And, it may be ideal for them to also embark on their own therapy or to do some couples work, which is one of the things that I do. But I think this workshop can kind of help set the beginning stages for that, because I think it will help each partner learn about their contribution and what they could do differently.
I actually have this email that has just come in, so I thought I'd read it and see what your thoughts are about it.
Okay.
It says, I've been married for 15 years and have 4 children, ages 12, 10, 7, and 3. She's got her hands full.
Sure does.
Our life is incredibly blessed. My husband and I work well together, but it seems we are more like business partners than spouses. We rarely make time for our relationship, and our sexual intimacy is uneventful and disconnected. I am afraid we will lose our love for each other, and when the kids are gone, we will have no connection whatsoever. What can we do? I guess go to your workshop for one, but...
Absolutely. That's exactly the kind of situation that we're hoping to be able to make a real difference in. Yeah, I think it is really important. And I think actually one thing we sometimes forget when we're parents, and especially when we're busy, and, for children of the ages that she's talking about, will keep anybody busy, is that it's really important for our children to also see a loving relationship. If what we would want for our children in their adult lives is to have a happy, close, sustaining, loving relationship with a partner, we need to model that, because there's a lot of things we teach our children by words, but there's even more that we teach them by our own behavior. And if we're not modeling that, they're very likely to recreate what they're seeing. Not consciously, but again, unconsciously. We're sort of giving them the roadmap of how to have a relationship. So it is really important to make time for your relationship, to take breaks from the kids, to take time to be together, to take time to do things that are romantic. And because that's what you want to teach your kids to do when they're grown-ups, right? Is to make time for their relationship. So I think that's really, really important. And it's good that you're working together as partners, because a lot of people lose that part too. And that you're being able to be, really, it sounds like cooperative in the way that you're raising your kids. But it's also important that you show them a loving, affectionate relationship. And the only way to do that is to really have one. So I think it's really important for partners to sit down and talk. I just wrote a blog about when our sexuality changes throughout our relationship. And I think it is really important to keep the lines of communication open about it, because if we just go through the motions of being sexual with just the goal of sort of getting through the situation, we often are very emotionally unfulfilled and even sexually unfulfilled, because we haven't really had that emotional closeness during the experience. And so I think it's really important if that's the situation, to really address it and to start talking. And often it turns out our partner's feeling that way too. And in fact, they may be attacking themselves that you're no longer attracted to them or you don't really want them.
Right. There are a lot of things that can come up, but I think that the greatest gift that we do give our kids is to have a very happy, loving relationship with our spouse. So just as we are coming to a close here, I want to make sure that we get all of the info out there. What phone number should people call if they would like to be a part of this workshop?
Sure. The phone number is 805-681-0415, and you can talk to Gina. And that's our number at the Glendon Association. And you can also go on our website, which is glendon.org, and you can sign up online as well.
Okay, great.
And get your questions answered about it. It is an incredible location, and we really make time for people to experience being there as well.
Okay. Well, thank you very much for coming on. I will give your phone number on my website, too. I think it would be great if I had you come back. It sounds like there's a lot more to talk about.
Thanks very much, Kimberly. I've enjoyed it.
All right. Thanks. I'm Kimberly Taylor, and you're listening to KZSB AM 1290. I want to thank Dr. Lisa Firestone for being our guest. Don't forget to check out her workshop retreat on creating a loving relationship. It's going to be held in Ojai, California, which is a gorgeous place to be. The dates are November 8th through the 10th. For more information, you can contact her at 805-681-0415, extension 232. The best person to talk to there is Gina. She can help you with that. And then you can also go to my website at drkimtaylorshow.com and click on guests to find out all of the information about her workshop. The purpose of this show is to really help you understand yourself just a little bit better, to hopefully, as we grow into a deeper and more thoughtful version of ourselves over time, we become more fully aware of ourselves. We figure out what is our purpose and what is the meaning that we bring to our lives. These are always questions that at some time in all of our lives we tend to ask. In order for your life to work and to have it be a life that you continue to grow and evolve in, it is important to do some of this searching, to ask some of those questions. And that's what this program is all about, being the best that you can by taking responsibility for your own actions, your own choices. And when you show up in a way that you are proud of, you can really feel good about yourself. I want to let you know that next week on the show, my guest is going to be Dr. Winifred Lender, and we will tackle the issue of sleep. There are lots of people out there who have all kinds of sleep problems. We all need to be able to get a really good night's sleep for our well-being, for our health. So if this sounds like you, or if it sounds like someone you know who has a sleep problem, then this is going to be the program that you won't want to miss. We will be here to answer your questions and to take your calls next Thursday afternoon between 2 and 3 p.m. So as we come to a close, I want to let you know that you can also listen to our program through live streaming by going to the internet on drkimtaylorshow.com. And I would also love to hear from you, and I welcome your comments about the show and your questions and our topics that you would like to hear. You can email me at drkim@drkimtaylorshow.com and join the conversation then. I'm Dr. Kimberly Taylor, and I will be with you next Thursday. So until next week, remember, no one else has to change in order for you to get better.